Welcome to my Thai presentation, Effects of Support Seekers' Community Knowledge on their Expressed Satisfaction with the Received Comments in Mental Health Communities. My name is Zhenhui Peng from the Hong Kong University of Science and Technology. I will first give an introduction on the research question and then present our methods, results, and discussions. Online mental health communities are popular and can help to improve members' mental health. For example, support seekers can create and health seeking posts, and support providers can leave comments under the post, and support seekers can reply back to those comments. In this paper, we look into the support seekers' satisfaction expressed in their replies to the received comments. Communicating satisfaction can benefit both support providers and support seekers. We explored the factors that may affect support seekers' satisfaction, the affected experience when expectation time standards are fulfilled. Community knowledge can be one important factor. It can be measured by how long the member has stayed in the community and how many posts they have created. We call them tenure and posting experience. Members' community knowledge could have positive or negative effects on the support seekers' expressed satisfaction, which we will explore in the analysis. Other factors that may affect satisfaction include the sought support in the fresh starting post and received support from the comments, such as the informational and emotional support. Our research question is how would support seekers' community knowledge, sought and received support affect whether they will reply or not and how they express satisfaction with each received comment in a depression community. Such understandings can help us understand how members' behaviors and emotional states change over time and design interventions to satisfy support seekers based on their tenure and posting experience. We conduct regression analysis on a dataset collected from a depression group. We have over 590,000 data for RQ1 and 155,000 data for RQ2. We built a model to estimate the expressed satisfaction in the reply using label data on M-tag and linguistic features of the replies as input. We measure support seekers' tenure and posting experience at the time they create the post. We build classifiers to predict the amount of sought support in the fresh starting post and build classifiers to estimate the amount of received support from the comment under the post from small, medium to large. Here is the data overview. We look into the effects of seekers' community knowledge on their expressed satisfaction. Through regression analysis, we found that support seekers with less community knowledge are more likely to reply to the received comments in their threads. And support seekers with less posting experience in the community will convey more satisfaction in their replies. These findings support the theory that as members experience more in the community, the marginal benefit of each instance of communication decreases. But our analysis cannot answer the why questions, which need further interviews with the support seekers. We also have other findings regarding how support provision and matching affect the expressed satisfaction. For example, the match between the types of sought and received support positively predicts expressed satisfaction in the replies. Several design considerations for mental health community. For example, we found that members with more experience would convey less satisfaction. We suggest that a bot can ask how they feel about a comment to elicit their feedback. These communities can also use our models for classifying sought and received support and present this information to help the support providers offer in need help. Our satisfaction model can notify human moderators of dissatisfying comments. In a summary, in this work, we explore the factors that affect support seekers' expressed satisfaction with the received comment in mental health communities. Thank you for your listening.